As a behavioral pediatrician, I see lots of kids, teens, and their parents for a variety of mental health challenges. When I do, I often tell patients at our first meeting that we're going to be doing a lot of talking so I can get to know them and their family. I tell them I do this by asking a lot of questions and asking for a lot of stories. Now, some of those stories are going to be awesome and some might not be so awesome, but that's okay because I am collecting clues as to what is happening. They are never in trouble for these not so awesome stories. And in fact, everyone has them because we all have good and not so good days, right? Later in the interview, it's also important for me to get some background information too. Information about family history because many mental health issues can run in families. But I tell parents that it isn't nature versus nurture. It's actually nature and nurture. And what I mean by this is that not only is family history important to know about, but also asking and getting information about adverse childhood experiences or ACEs. Now, ACEs is something that pediatricians want to know about. ACEs are experiences that include abuse, neglect, domestic violence, trauma, parental mental health or substance use, divorce or separation, having a family member in jail. Any of these experiences in one's childhood has been shown to influence lifelong physical and mental health. However, I tell parents it is not all doom and gloom if they report having any of these experiences in their own lifetime. The cool thing is that we now have research to back up the fact that protective childhood experiences are just as or even more important to talk about with families. Why? Because having even one safe, stable, and nurturing parent or caregiver or an adult can help a child thrive. Plus, we can teach resilience. We teach these through connection, coping, character, confidence. We support parents to learn these skills and how to model and nurture self-awareness, emotion, skill building, self-care, and mindfulness. That's why I love doing what I do. I try to help empower families who might have kids who have ADHD, anxiety, depression, who are struggling at home and school, to reconnect with each other and find their inner strength and learn to see that we all have gifts to share with the world. And while we all have things we're working on, we can know with unwavering faith that we have a team of people to help us through. It does take a village.